We're going to be going over the multiple choice questions here in 7 questions. Here we have an example of a sampling designed question where you've got 30 Major League Baseball teams with 40 people on each roster. The goal here was to create a sample of 60 players total. This would be randomly selected to undergo drug tests. In order to do this, they put 40 names in a hat and they drew out 2 names per team. The question was, will this result in a simple random sample of the 1,200 baseball players? The answer is absolutely not. First of all, we know that because you had to break them into groups of each team, then the different groups of 60 players, there are some groups of 60 that are not going to be possible. In order for it to be a simple random sample of all 1,200, that means that every possible group of 60 needs to be at least possible, right? That would mean that, well, what about the samples where 3 people came from the same team? Just that one example provides enough evidence to say that it's not possible for it to be a simple random sample, because there are some of those samples of 60 that can't physically happen because of the way that you organized it. So in this case, it is not a simple random sample because each group of 60 players does not have the same chance of being selected. Some of the groups of 60 are impossible, meaning it's a probability of 0. A stratified sample, which that is what this is not a special case of simple random sampling. So answer choice C is a stratified sample, yes, but that is not a case of simple random sampling. In fact, none of our examples are special cases of any other types. They're their own sampling design. Okay, number 6. Here we have a study of Parkinson's disease, had 100 volunteers, had incisions made through their skulls. The patients were randomly sorted into 2 groups, one of which had a new drug inserted in the brain, the other had skulls where nothing was put into their brain. The patients did not know who received the drug. In the weeks to follow, all 100 volunteers showed similar improvement in their physical condition. What is this example of? This is a pretty easy question. This is an example of the placebo effect. The people who got better with the medication also showed the same amount of improvement as the people who did not receive any medication, which means the actual medication didn't have a significant effect on the improvement of the individuals. Number 7, 50 migraine patients were randomly selected from hospital records. Half the patients were told to drink ice water and sit in the dark when they experienced the next migraine. The patients were told to either use either of these possible remedies. Participants then reported back to S2 Relief if any. Serious faults of the survey include what? First of all, remember when randomization is supposed to happen in an experiment. It says 50 patients were randomly selected from the hospital records. That's fine, but inside of an experiment, we want to randomly select people to do the different treatments, and that was not mentioned here. Half the patients were told to drink ice water and sit in the dark when they experienced the next migraine. The remaining patients were told to use neither of these methods and just sit in the dark in general. So that's your control group, right? But it does not apply the randomization process correctly, or at least we don't know. So we're going to assume this is not true, right? So no, it has a lack, or I guess this is true, is lack of randomization. Yes, that's true. It did not randomize properly. Okay, 2, probable confounding variables. Yes, when they were told to drink ice water and sit in the dark. That would mean that, well, which one was it? Was it the ice that made a big difference, or was it sitting in the dark that made the big difference, or was it both, or neither one, right? This is a problem because we don't know which of these 2 things are going to work, if either one, right? So you have a confounding situation because both of the variables are doing it at the same time, where in the other one, no one is using them. So the control group seems to be fine, but you don't know which of the 2 variables are actually making a difference, if it's just one of them or if it's both of them in combination. 3, lack of blinding. is this a problem, right? So we're asking, are these serious faults in the problem? So I'm going to go ahead and be honest. You can't blind somebody if you tell them to drink ice water and sit in the dark. I have a feeling they're going to know that. So this is not a problem for this situation, because the scenarios cannot be blinded. It is not possible for them to be able to do that because of the nature of the treatments themselves. It can't be done. Design 8. Which of the following are the most useful in establishing cause and effect relationships? Remember, an experiment is the only time that we've ever said that a cause and effect relationship can be set up. So this is a really straightforward question. They're just trying to see if you remember the basics here. 13, which of the following is the most important in minimizing the placebo effect? Well, in order to use the placebo effect, we have to blind our subjects in the situations in each of the groups, right? So blinding is really important. If I don't use blinding, then I've got a real big issue. But what else needs to happen in order to look at the placebo effect? The second part is that control is another thing that affects. I have to be able to look at that base group and see if my other treatments improve in the same way that the control group did. That's what we would decide if there was some sort of a placebo effect happening, and that makes it able to kind of judge how much the placebo effect makes a difference in this group. So blinding and control are very important when it comes to kind of judging how much the placebo effect matters. That's the control group. And then blinding just makes the placebo effect possible. If people knew what they were getting, the treatment they were getting, then the placebo effect would not be something that you would be able to do. Number 18, which of the following statements are true about blocking? Okay, blocking, number 1 says blocking is to experimental design as stratification is to sampling design. That's true. Blocking is a way of grouping in experiments. Stratification is a way of grouping in sampling. Do not confuse these two. Block design is not stratification. They work in the same way that we separate them into groups, but other than that, they're not the same thing. Right? Blocking is only for experiments, and stratifying is only in sampling. 2. So 1 is true. Number 2, by controlling certain variables, blocking can make conclusions more specific. Yes. By blocking, we can make sure to separate the groups and have a much more specific response. If males and females are different about a certain treatment, then I would be able to say that the males had a more specific response than the females did, but it allows me to kind of make those comparisons. The paired comparison design is a special case of blocking. That's also true. Paired is where you give one person both treatments, or one group both treatments. That's a special case of blocking. So D. In order to use block design to answer this question, first of all, you have to know what should I block on. It was specific, and it tells you that each patient has his or her own room. And it says some of them have spectacular views of the ocean. Now, if you keep in mind that you're talking about being depressed, right? So having a beautiful view can sometimes bring pleasant emotions. Having no view at all, or having a view that's not a pleasant one, can be depressing. And so that would be something that I wouldn't want to have a lurking variable or confounding variable. And so we should break it apart based on the rooms, and then you should have the rooms that are that have a view of the ocean, and then you should have the other block with the rooms that don't have a view of the ocean. And you're going to create 2 different groups, one with the antidepressants, with each antidepressant, and you're going to be able to compare them. Potentially, you might want a placebo in there just to make sure that anything happens at all. But let's see. Within each block, randomly pick half the patients to receive each antidepressant. That would be, that's not quite specific enough. Let's see. Part B says, randomly pick half of all patients to receive each antidepressant, but then analyze the results separately by blocks. Well, that's true. We don't want to bring the blocks together to compare. C, randomly choose which blocks will receive which antidepressants. So randomization, at this point, B does the best job. Let's go on to D. Randomly choose half the blocks to receive each antidepressant for a given time period. In the same block period, switch the medication in each block and compare the results. For ethical reasons, patients should be allowed to choose, definitely not E. The question says, how should randomization be used for a randomized block design? I think I misread answer B. It says randomly pick half of all patients to receive each antidepressant. Done. But I think that's not true. I think for part B, I think it needs to be separated into blocks first and then given out the patient. So what you'll have to do, A is a much better answer. It says within each block, so you've already blocked, so blocking happens first. Then you will randomize to give half of your patients the antidepressants, whichever one it is, and the other half to receive the other antidepressants. So answer A does the best job here of specifically answering the question, how should randomization be used for randomized block design?